Hey, it's Dr. Wyrick, and what you're about to watch is last night's live webinar. It was done on May 20th, 2019. It's exactly 28 minutes long, so hang in there, go through the whole thing, and don't forget that you can always schedule an appointment where you can sit and have a phone consult with us to determine whether or not this is right for you. So 28 minutes long. See you on the other side. Thanks.
I can't tell if you guys can see my screen or not, so we're just going to go for it. So here we go. I want to welcome everybody here. Thank you for joining us for this webinar. My name is Dr. Brady Wyrick. I'm the Clinical Director of Intermountain Regenerative Medicine. We have offices in Idaho Falls, Idaho, and also in Bountiful, Utah. I did notice with the list tonight that most of you folks were checking in with Utah phone numbers, so that's awesome. We'll look forward to sharing this with you. So to get going, though, there's a couple of disclaimers that I'd like to go through. Number one, we're here tonight for educational purposes only. I don't like sales. I'm not going to make this a sales pitch. Other than this, at the end of this, I'm going to give you a link that will allow you to actually schedule a consultation with us, a phone consultation with us that will be at no cost. So if you like what I say tonight, schedule that phone consult. We're going to give you a link here before too long where you can do that, and then you can just chat with us whether or not this is right for you. So educational purposes only. We're not going to give you a sales pitch. Second thing is that stem cell therapy is not approved by the FDA. I think most people actually know that, but it is cleared and watched by the FDA. They just haven't approved it for anything yet, so I can't sit here and tell you that it's going to treat anything. People ask me how far away they think that we are until it is approved. I really don't know, but because of that, it is not going to be covered by insurance, Medicare, third-party payers at all. So we will go through exactly what stem cells cost here before we're done. So next thing is the Intermountain Regenerative Medicine is a medically integrated clinic. My background is actually in chiropractic. I am a licensed chiropractor. I've all but retired from that world. My role in this clinic is nothing more than education. I'm here to teach and to help you understand what your options are. And we have a full-fledged medical staff that actually does the injections for us. So it's not me on injection day. It is our nurse practitioners that do that. So my screen just went away. Interesting. Okay. Next thing is that we utilize stem cells that are derived from donated to human umbilical cords. It's every time that we do these types of talks, these types of webinars, someone gets fired up about us using stem cells that are coming from aborted fetal tissue. That is not true. That is not legal, and it's not safe. We utilize them coming from donated umbilical cords, meaning they're actually coming from healthy moms, healthy babies. So we'll get more into that as time goes on. And on my normal seminars, what I like to do is sit and go through the stories of the people who have actually done this and share with you the testimonials. On the webinar version, I like to keep things short and sweet, so we skip these. Just know that they are available on our webpage at imregen.com. They are also available on our YouTube page if you search for my name. So we won't spend any time here. Let's just get into the nuts and bolts of this. First thing I want to do is just talk about what is a stem cell. There's a definition of the stem cell that I really, really like that I actually got from one of my patients, and that definition is a stem cell is a blank slate cell. In other words, it is a cell that it's just a cell. Its only purpose is to be a cell, and it's your body's natural reparative mechanism, so that when you get injured, inflammatory chemokines will direct this cell where it needs to go, and it can actually reduce inflammation. It can help calm your immune system down and actually start becoming whatever tissue that is that's injured. So if you think about it, chronologically, the very first stem cell, your entire body started from one single stem cell. The day that you were fertilized, the day that your mom's egg was fertilized by your dad's sperm, started the first stem cell. Now, those stem cells are called totipotent stem cells, meaning those particular stem cells that come during the embryologic period of life. Those cells can literally become any cell inside of the human body. That's the embryonic stage of this. At about 8 weeks, you go from an embryo to a fetus, and your stem cells become pluripotent stem cells, which means that they can come from any one of the 3 germ layers that come from embryology. So there's a whole bunch of different tissue that comes from that. Now, it's up until birth. At birth, your stem cells actually become adult stem cells that are known as multipotent stem cells, which means they can become a lot of different things, just not everything. So everything that goes on, any stem cell that would be used before birth is actually not safe to use, because it can literally become any tissue inside of the body, versus an adult stem cell, once it gets into the umbilical cord, can only start to become very, very certain things. So that's the definition of a stem cell. We like to call them blank slate cells, because stem cells they're blank slates that can become whatever the body needs them to become. So check out this paper. I think this is pretty cool. Stem cells have emerged as a key element of regenerative medicine therapies due to their inherent ability to differentiate into a variety of cell phenotypes, thereby providing numerous potential cell therapies that treat an array of degenerative diseases and traumatic injuries. In other words, or in English, that means that those cells, or you can use stem cells to do a lot of stuff, because they are those blank slate cells. So here we go. This is a chart of what we call the mesogenic process, or about mesenchymal stem cells. This is the blank slate cell thing. I promise not everything's going to be this boring, but this is up here. We have that blank slate cell. Right now, that blank slate cell is hanging out inside of your bone marrow and inside of your fat tissue, and it's ready to be released to go and repair whatever your body needs to repair. So these mesenchymal stem cells, if you get injured in a muscle, guess what those stem cells can become? They can become muscle. If you get injured in a tendon or a ligament, guess what they can become? They can become a tendon. Same thing for fat tissue, etc. So these are the things that they can become. And to me, this is just awesome. I love this whole process of, you've got a blank slate cell, what your body's natural reparative mechanism. When you get injured, these blank slate cells can become just about anything inside of your body. So if you think about it, if you get injured in your meniscus in your knee, guess what these stem cells can become? Meniscus in your knee. If you get injured in your bone, guess what they can become? They can become bone. So the question then becomes, if we have this awesome natural reparative mechanism, how come as we age, we degenerate? Why is it that we break down and we can't heal ourselves anymore? And there's a couple factors at play. Here's one of them. When we are born, 1 out of every 10,000 cells that we have is a mesenchymal stem cell. As we age, that number of stem cells drops off drastically until you hit about the age of 80, when you have about 1 out of every 2 million cells is a mesenchymal stem cell, which means you just don't have enough cells to activate and to reproduce and to replicate that tissue and rebuild that tissue. So you can't heal as fast, and it drops off drastically. Now think about it. If you get in this period of your life somewhere here, and you get an injury, what's going to happen to your stem cell reserves? They're going to drop off drastically. And these are the people that, when they go through something stressful in life or they get injured, these are the people that don't do very well afterwards. Their health rapidly declines. I know you've seen people like that, because I know I have. Okay, carrying on. So think of it this way. Think of this down here, all these blue shapes. Think of this as healthy tissue. Now, as we age, we get injured and we start to degenerate, and we get dysfunctional tissue. That's what these red shapes represent. Okay, so when they start to get injured like this, we start to hurt, and so we go to the doctor to find out what's going on, and we get an x-ray like this one taken. Okay, so if our tissue looks like this might be what that x-ray looks like. So we have the top part of the knee here and the bottom part of the knee here. There's about 2.8 millimeters of space between those two areas, which would be known as a bone-on-bone joint. So when people ask me what's the number one thing that we use stem cells for, it's to help joints like this that have osteoarthritic, even bone-on-bone cases, because these stem cells can actually help to reproduce replicate and reproduce help you grow new cartilage. So this is a bone-on-bone case. This is a case of tissue that looks like this, starts to break down, and we start to get here. So when that happens, we hurt. The joint doesn't move like it used to. It's cutting into our activities of daily living, and on and on and on. And we go to our medicine cabinet, and we get some sort of anti-inflammatory, which helps because it takes away some of the inflammation. So some of the pain is gone. But when that stops working, then we start taking more and more of it. And when that stops working, we go to the doctor, we get on something stronger. But again, we're just looking at the inflammatory process and reducing that. And that really does nothing for us to help regrow new tissue. Okay, so when those medications stop working, then we go and get a steroid injection. And there's nothing wrong with doing that. That's not what I'm saying. But that steroid injection helps reduce the inflammation. But what does it do to help regrow new tissue? And the answer is nothing. Okay, so on we go until this thing gets to a point where you can't walk or you can't sleep. Then they'll go in and surgically replace the joint. That's the gold standard for general osteoarthritic joints that we have right now. So what we're proposing tonight is the ability to take something like human cell and tissue product or a stem cell injection and introduce it to this dysfunctional tissue. So what will happen is, this is actually a case from a friend of mine. This was a 54-year-old male that walked into a clinic and got an injection into that knee of stem cells. And number one, you reduce inflammation. Number two, you stimulate and modulate the immune system. And number three, you start to regrow and replicate new tissue. So with this particular case, he introduced this the human cell and tissue product or stem cell injection into that joint. The stem cells followed those inflammatory markers to the site of where they were injured and started to lay down these building blocks to help grow and repair new tissue, to the point that this is that same knee 4 weeks after the injection. That space had gone from 2.8 millimeters to 5.3. So you can see they're starting to get a little more cushion there. So these cells continue to do their job. And then all of a sudden, 8 weeks after the injection, that space is all the way to 6.1 millimeters, meaning these folks are growing new cartilage. And this particular knee is now, not only is it a less painful knee, but it's a more mobile knee. Right, so if you look at this and side by side, here's the 2.8 millimeters, here's the 5.3, and here's the 6.1. This is what it looks like on an X-ray. Here's what it looks like in a study. They took 18 people, injected them with mesenchymal stem cells into the joint capsule of the knee, and look at this. The size of the cartilage defect decreased while the volume of that cartilage defect increased. So these people were growing new cartilage inside of that knee. Now, normally on the seminar version of this, I'll put in a video of my dad right here. About 5 weeks after he injected his bone-on-bone knees, I show a video of my dad riding his bike, which I think is pretty cool. But like I said, we cut that stuff out to keep things short tonight. Now, let's look at the history of regenerative medicine and kind of where we are and where we're going. Going back here to the pharmaceutical industry, this chart basically shows us, it says, are these stem cells going to come from you or are they going to come from somebody else? And these cytokines are the basic building blocks that you need and growth factors that you need to grow new tissue. And then you have the mesenchymal stem cells down here, which actually help to replicate and rebuild new tissue. So when you're looking at what types of stem cell to use, you want to look at all of these factors. And the pharmaceutical industry right now really doesn't have a whole lot to offer as far as a medication to help you grow new tissue. Now, it started off then with PRP, or protein-rich plasma injections, where they take your blood, they spin it down, they inject those proteins back into that joint. And they're awesome because they help with these cytokines. They help rebring these cytokines, these growth factors into the knee. and you can actually stimulate your own stem cells to start reproducing and to start building new cartilage. So PRP has been really, really good for a long time. But as you can see, over the long haul, you're not going to have the mesenchymal stem cells in here. So the lifespan is shorter if you don't have stem cells. So PRP went over here to what we call autologous stem cells, which bone marrow and adipose are the two places you can get autologous or from you stem cells. These particular procedures require you to either take the stem cells out of your bone marrow or take them out of your fat tissue, which gives you the mesenchymal stem cells that are alive that you want. But the problem is they're not coming from a biologically young source. So if you're going to use your own stem cells, I think this is fantastic because it can help you regrow and renew tissue, unlike what medication can do. But you're limited by how old you are because your stem cells, you just don't have as many of them, and they don't replicate at the rate at which they used to. So you are limited here by your age. And what we have found is that doing your own stem cells actually costs a little bit more money, and it's not quite as effective just because of your age. Now, again, this is still a viable option, and if you want to go this route, you have my blessing. I hope you would go do this. But what we're finding now is that there's something that's better out there. It's less invasive. It's a little bit less money. And we're actually getting fantastic results by using them from donated umbilical cord. So I'm getting ahead of myself here a little bit. Next came placental tissue, where we're looking at placenta and the amniotic fluid, which was great because it gives us a lot of those building blocks that we need that are coming from a young source. But what it's not giving us is the numbers of mesenchymal stem cells that we want, which takes us to the richest source of stem cells that there are, which is the umbilical cord itself, specifically the matrix of the umbilical cord. And what I mean by that is if you have an umbilical cord, you have two arteries and a vein going through the umbilical cord, and surrounding that cord is this matrix of stem cells that basically protect the baby from the mom's immune system. And once the baby's born and mom consents to donate that cord is then usable, granted that, or given that mom has been tested, the cord has been tested, and everything is safe, we can use these stem cells to inject into another human being. So if you look at it in these terms here, what would happen is you take those stem cells, and this is really the true for any any encapsulated joint like shoulders, hips, ankles, knees, elbows, etc. You insert them into, our nurse practitioners will put them into the joint space, and those cells start replicating at an extremely fast rate. Remember, these are cells coming from a newborn. That means they replicate about every 28 hours, and that's why you see growth like this happen. So I'm pointing at my screen like you guys can see me so quickly. It's because we're using the umbilical cord stem cells. So really, from what I've seen and from what we've seen here in the clinic, these are the best, most viable ones that we have. And it's not the least invasive as well, because typically these are just simple injections. So that's kind of where we've been. What else can stem cells help with? So I think we've beat that osteoarthritic drum. I can't beat it any longer. I wish that we were at a time that stem cells, using umbilical cord stem cells, was the first round of defense rather than the last round of defense. But that's where we're at right now, is that what we're getting the best results with are osteoarthritic joints. There's about 6,000 studies going on worldwide of other uses that we can use stem cells for. And people will ask me questions all the time. Is it good for this? Is it good for that? This was a psoriasis case that walked into my office that did stem cell therapy. This is the day that we injected George's knees. This is about 15 weeks after the injection. You can see those stem cells really have calmed that reaction down and made a better quality of life for this gentleman. So when people will call me and ask me, hey, what can stem cells help with, X, Y, Z? Then I'll just walk them through the three things that stem cells do. Number one, they're anti-inflammatory. Did these knees have inflammation in them? You bet they did. Number two, they help modulate your immune system. This is an autoimmune problem. This immune system's dysregulated. Needs help. Stem cells can help calm that down. And number three, they can help regenerate and regrow new tissue. So I will literally, when we do these consults with people, walk through them step by step so that they understand, hey, here's what we can do, and here's where we can go. So what else can they help with? There's a lot of other things, but right now we're going to focus on osteoarthritis. Here's a study, however, about human umbilical cord mesenchymal stem cell therapy for patients with rheumatoid arthritis. The individuals that had a significant remission in their disease criteria even 6 months after the injection happened. So there is research that's going on and on into these other conditions. But like I said, right now we're getting the best results with osteoarthritis. So a couple just general questions that I get. Number one, does stem cell therapy hurt? Well, this is my dad, by the way. This is the day that he got injected. It's getting an injection, and people will compare it to, and they'll say it's not quite as bad as doing a like a steroid injection. It's about like getting an immunization. So you are getting your skin pricked. There is a little bit of pain that's involved with that. But overall, we've had 84-year-old women tell you that it didn't hurt. Our stem cell coordinator, Dave, he had both of his shoulders done. He said he didn't feel a thing. So I personally don't like needles. So when I did it, it was a little painful for me, but I don't like needles. So we use the smallest needles we can. We do have some running jokes about that I will spare you. But this is a big question. How long will it last? I'll tell you this. What to expect when you get these injections done. We have a small percentage of people that will actually get off the table and feel better just getting off the table. And that was certainly the case with my dad. He was one of those ones that felt better and continued to do really, really well and continues to do really, really well. I was just down with my dad this weekend. It blows my mind. It's been a year now, and he's getting up and down and just doing awesomely well. So there are those people that will feel better the day of their injection. For most people, though, it takes about 8 weeks before they really start to see a difference. And then we have a sweet spot between 6 to 9 months. Now, how long will it last after that? That question is up to you. Okay? I will tell you that there's studies that have shown that 5 to 7 years after an injection, you can still see some help from those. There's other studies from other countries, like China, that have been out to 15 years. But here's the deal. We're helping your body grow new cartilage. And if you grow new cartilage and you don't take care of yourself, your body's going to break that cartilage down and you'll be right back in. Most of our patients, we don't see them again because they build new cartilage. They take care of themselves. They exercise. They eat better. And they're off and gone. We do have a few that do end up coming back in. But that has happened maybe 3 times since we've been doing this. But how long it will last, I can't tell you a straight answer. I will tell you the studies what the studies have shown. But that really just depends on you and how you take care of yourself. So takes us to the next question. Is stem cell therapy right for you? Hey, there's a couple things you need to ask yourself when we do this, or that we need to talk about. When we do this phone consultation, okay, and I will post the link to the phone consultation here pretty quick. When we do this phone consultation, one of the things I'm going to ask you is your height and weight, because body mass does matter. Okay, I'm going to ask you about medications that you're on so we can know about any underlying disease processes that are going on, because those are also important, because the more disease processes that are going on, the less chance that it's going to work. But these are all things we just need to discuss one-on-one. Your overall health status is very, very important. Number 2 is your mental mindset. If you're expecting a miracle, if you're expecting to get injected and be 25 years old again, you will be disappointed. If you're happy with getting 50, 60, 70, 80% function back in a particular joint and everything else looks good, then that may be a good mental mindset to have. If you're coming into this saying, I'm wasting my time, I'm wasting my money, guess what? You're wasting your time and you're wasting your money. It's those people with a poor mental mindset, they don't do as well. But that is something we discuss during the consultation. Last part of this is the financial part of this, because I will tell people every day, I will say, look, if you're going to spend your last dollar doing this, I'm going to recommend that you don't do it, because I know it's not cheap. So here's how the cost breakdown works. We have 1 cc, which is one joint. 1 cc is $4,250. Okay, so one joint, think big knee, like shoulder, knee, hip, etc. 2 cc's is $67.50, and then 3 cc's is $92.50. So there is a price break. The more that you do, if you do the first one is $42.50, then each additional one on top of that is $2,500. But here's going back to what I was saying about the financial part of this. If you spend your last dollar on this and you're now broke and don't have any money, guess what that's going to do to your ability to succeed in this? It's going to greatly diminish it because cortisol levels will rise and the stem cells won't be as effective. So we'll just have a very real and frank conversation about that. When we do this consult, we'll basically just sit down and say, okay, what's your number one priority? It's that right knee. Well, let's inject the right knee. And if you want to do the left knee at the same time, you can. Here's the price difference. And we'll just go through line by line about what's most important for you. Now, our payment options, there's cash, check, or credit card. You can use your health saving account. You can use your flex spending account. We do have some financing options that are available. Those are completely, that's up to you. We will talk about what the options are when we do that consult. So that takes us to what's next. And what's next is I'm going to step out of this for 2 seconds. And I'm going to post or figure out how to post the, there we go. You should have now a link where you can actually click to actually get that consult. And let me just post here. I'm going to put it up here as well. Give me 2 seconds here, guys. I'm going to paste that there. There is the direct link for that consult. So now that we've been through that, you can go and see those. Let's wrap up the workshop, and then I'll come back, Jeanette, to get to your answer here just shortly. So what's next is the consultation portion of this. This is when we sit down and we're going to talk about your areas of degeneration. I'm going to ask you when we talk on the phone. And by the way, when we talk, I'm going to call you from an Idaho Falls number. I typically call people with my cell phone, so please answer it when I call. But I will ask you, what's your number one goal? What's your number one priority? What's the number one area? Then we'll talk about your strategies. We'll talk about the cost options, what you have there. I want to make sure we answer all those questions, and then that your spouse is involved. Scheduling and timing is very, very important. Right now, to do an injection, we're about 3 weeks out. So we got to consider that's what, mid-June. And if it's mid-June, that means you're 8 weeks after that before you start to feel better. So we're now into the fall before you really start to see a difference. So you have to kind of think of things backwards when it comes to when is best for you to proceed forward for this. So here's what I'm going to do. Since you were on this with me tonight, if you schedule that consultation in the next 24 hours, we're going to give you a $400 voucher off your first injection. So that's going to save you a little bit of money. But you do have to schedule here quickly. I just gave you the link. That consultation can be done over the phone or in person. Number two, it's important that you keep your appointment. Like I said, I'm going to be calling you from my cell phone, so make sure you answer when I call. And then lastly, we want you to use that voucher within 90 days. So I've covered everything as far as the actual presentation is concerned.
Hey, it's Dr. Wyrick. Thanks for sitting through that webinar. If you got those specific questions, you're ready to make that consult a reality, just click on the button below, schedule that consult, and we will talk and find out whether or not this is a good fit for you. Thanks a lot. We'll talk to you soon.